do that, I look that up.
It's thick, you know, and just, you can't turn it off. There's absolutely no idea how to turn it off. Hey, buddy, how you doing? Hey, how you? Oh, yeah. That's where he goes, that's where he goes to tap people.
So like 200 are now in quarantine.
240 out of the 900?
Oh, 200.
So they cleared out 300. Before, they cut it in half. Oh,
It was up around 18, 1900.
It's like one
Yeah.
whole
Okay.
sample.
All right.
Got over 2,000 at one point last year, right?
Yeah.
Yeah, 2,100 or something?
There was a period of time when they were up around 22, 23.
Face ID doesn't work anymore, it's stupid.
Now we're down to 9,
So-
and you said 200 in quarantine? Just,
Possible
what about,
exposures.
what about, COs?
Last I heard 10.
10 COs, oh, that's actually lower than we think.
That they know of.
But they don't,
We just did an
Prison
arraignment
virus
last,
soup.
a couple of, the last week, I did an arraignment with a guy who was infected. And he was in a yellow poncho
Oh,
and a
man.
mask, and he was stuck in this room.
Are they doing all video arraignments then?
A lot of them.
Otherwise, basically, it was like, okay.
Most of them.
You're gonna have to agree to not get a speedy trial.
There's been a couple that they show up in person, doing everything. If the person is, not in jail, they can get reposted. Like, really,
Mm.
we do about this week, 3 weeks. So we go like Fridays.
Good morning.
Good morning. Good morning. One, two, three, four, 5, 6, 7, 8, 9, 10. So good morning. Yesterday, in the governor's press conference, he laid out the first steps for Ohio's restart. These initial steps will introduce a core group of businesses to conducting daily activities under a prescribed set of guidelines. The intent is twofold: to get people working again, and to also take the necessary precautions to protect those people as they return to their respective work environments. As the reopening progresses, the plan employs the continued use of proven prevention and mitigation strategies that have served us well in the flattening the curve in Ohio. I want to first thank our environmental public health staff who have been very busy working in the field in helping businesses to try, the essential businesses to do their best to adapt, to prevent exposures, and to assist with the mitigation strategies. They're going to continue to do that in the coming weeks and months. And we also have a call center that has been very busy in answering calls from the public, and we expect that will also continue in the coming weeks and months as the restart continues. The first group to return to work will be healthcare providers with expanded services, and these include dentists and veterinarians. Hospitals will be permitted to perform procedures that don't require an overnight stay. And so that was May 1st that these have begun. And using appropriate personal protective equipment also is essential in those environments, as it has been. Manufacturing, distribution, and construction will resume for many businesses, while others in these industries have been able to operate during the pandemic as essential businesses. Regardless, businesses will now have to follow a strict set of guidelines in order to remain open. These are a set of some tried and true public health prevention measures that many of you have heard over the past several months, related to 6-foot distance between people, and if not possible, install barriers. As you've been out in locations like grocery stores and the like, you'll notice that there are plastic barriers that have been set up, and those innovations have been great to see, working with businesses, public health, sorting through those barriers in order to, sorting through those issues in order to prevent exposures. That includes the usual daily symptom assessment for employees and symptomatic folks staying home. And again, promoting that remote work throughout. Face coverings being worn at all times. This is the face covering being worn at all times is all through the guidance. In fact, it's important to note that the guidance says from the governor yesterday that specifically the guidance says that if you have no mask, no work, no service, no exception. So that's guidance to basically validate the importance of having a mask. If I wear a mask, I protect you from me. If you wear a mask, we both are protecting each other. And so there's the philosophy, and certainly it's always great to see our folks in the media, all of media professionals here, following the guidance, public guidance, and the tried and true public health prevention guidance, wearing masks, and we thank you for that leadership as well. So you'll see that many of these, and we won't repeat them, but many of these guidelines around prevention that we've just described are throughout the guidance from the governor, and there are a number of great graphics that are available from the State Health Department. The role of local health departments is to be there to work with businesses going forward, help to problem solve. We address concerns that may arise. This is not new. This is a role that we've had since the beginning of this response. We'll address concerns as they arise. We know that when we look now at moving into mandatory issues around shift work, we also know that daily and disinfection of desks and workstations will be part of that. Changing of shift patterns to try and have fewer shifts, and staggering of lunch and break times are also important ways to reduce exposures. We also know that spacing the factory floor to allow for proper distancing and regulating the maximum number of people in cafeterias and common spaces, and establishing a maximum capacity. This is a guideline that we see throughout all of these settings. 50% of fire code as a guidance, 50% of fire code. We've seen businesses adapt, and the solutions have been creative in working to reduce risk, and we look forward to working with businesses going forward to continue those approaches. For general offices, they will open on May 4th, and that'll bring lots of people back from remote locations while others still will remain off-site. I think businesses, public and private, have gotten a crash course in the last few months on how to work remotely effectively, and they've worked the bugs out of some of those solutions. It's not perfect in many cases. It can present challenges that perhaps face-to-face communication is more effective, but we're going to be seeing some combination of on-site, off-site efforts in order to address these, the need to try and reduce risk. So for employees and guests, it's the 6-foot minimum distance as well. Staggering arrival of employees and guests is also an effective way to prevent this congregating issue around risk and people being close together. Mandatory physical spaces in and workstations and offices. There's some issues here that we need to talk about. Frequent disinfection of desks, workstations, and high contact surfaces. Daily disinfection of common areas. And also canceling or postponing in-person events when social distancing guidelines cannot be met. That's another great way to reduce risk. Redesigning workstations to allow for that 6-foot distance between workers, and close cafeteria and gathering spaces if possible, or conduct regular cleanings. All these guidance documents that have been created have been following what has worked for Ohio, what has helped to flatten the curve. So these should be familiar to us as we reopen, and we need to take them to heart. And public health is there to offer guidance at the local level as necessary. We also know that face coverings, as I said, are critical. Hand washing is critical. Hand sanitizers are important in availability in high contact locations, and cleaning of high touch surfaces, carts, baskets, and the like are also critical. We also want to have signage that will be helpful to customers and guests to assure that they follow the 6-foot distance. And we've seen signs available in many business locations where they're becoming part of the public health effort, and asking customers and guests not to enter if they're symptomatic. So there are also some best practices that we've seen for retail customers that relate back to, where possible, accept customers by appointment only, or increase availability for curbside pickup, which reduces risk for exposures. We also, there are some recommendations also in retail environments around disinfecting high contact surfaces on an hourly basis. That also reduces risk. Discontinue self-service food stations, product samples, and food courts remain closed. We also encourage retail businesses to use contactless payments where possible, and increase the capacity for delivery, as I said, delivery and curbside pickup where possible. It's important to note that there is a graphic on the state website that describes businesses that will remain closed at this time. And they include K through 12 schools and daycares, restaurants and bars, personal appearance beauty services, older adult daycare services and senior centers, adult day support or vocational habilitation services in congregate settings, rooming and boarding houses and workers' camps, and entertainment and recreation and gymnasium sites. So they remain closed. The idea here is we have a tiered process for reopening or restarting the state. And so that's important that we take this in a measured way so that we can understand and take the time to reduce this risk. Ohio has had a plan that has been effective in flattening the curve, and so following the Ohio plan is the way that we continue to move forward. So the governor also provided some information, switching gears, on contact tracing. And so we know that the state has recognized the need to assist local health departments in their efforts in regards to contact tracing. So what we do is, as you know, is if we have a person who is a positive case for COVID-19, then we will identify those close contacts, and the case will be isolated, and the close contacts will be quarantined as a precaution to reduce risk. This has been in the public health playbook for 100 years, going back to issues around tuberculosis, measles, a whole range of infectious diseases. Public health has been working in conducting contact tracing. We are now looking to expand that work going forward based on the needs. And so, so we know that as of last night, according to the data from the state, is that we had about 1,500 well, certainly our data is that we had 1,563 cases and had established nearly 3,000 contacts in our jurisdiction. So that's a lot of work, lots and lots of work. It can take up to several hours per interview, depending on the nature of it, to ascertain close contacts and follow up with close contacts. So it's a lot of work. So we're now developing sustainability plans for contact tracing and surge capacity over the next 12 months. Across the state, health departments are struggling to keep up in some places due to the demands that contact tracing places on their staff. And they don't have the number of people they need to do the job. So to that end, Governor DeWine spoke of a plan to increase the capacity for contact tracing statewide. The Ohio Department of Health has identified nearly 700 staff from local health departments in Ohio who are suited by job description to conduct contact tracing, and staff may be temporarily retasked for contact tracing as needed. The goal is to increase the total number of contact tracers to 1,750 in the state. The new group of more than 1,000 people would be comprised of local hires working directly with local health departments in addition to state-trained employees. The state is creating a strike team. If you had a surge in a certain situation in a congregate setting where you had a group of cases emerge, the idea is that the state could assist places that needed help, local health departments that needed assistance to respond and begin to control the spread in those environments. There also are a group of volunteers that are part of that process that can also be identified to assist intermittently with surge needs. The state has set a target date of June 1st to begin this effort, to be prepared for the potential for a fall surge. As we know, flu season usually we start with vaccination for flu, usually in September, and it can run through March, flu season. So we will, of course, be focusing on the need for flu vaccination. We don't want people's immune systems, because they haven't been protected by a flu vaccine, to be more at risk potentially. And Dr. Gullett can speak to that. But the flu vaccination is a great way, as we've said throughout this response, to help to prevent risk of other infections, including COVID-19. So as a region where activity level is high compared to the remainder of the state, we look forward to the rollout of this plan and will continue to work closely with our partners in the planning process. As I wrap up, I'll just say that all this is new for us, this new normal for local health departments, and this expanded role of contact tracing and expanded role in the community and helping businesses to problem solve around a new way to serve the public and to do it safely. So we have been and remain committed to support Governor DeWine and Dr. Acton in this rollout of the plan. And we know that public health plays a critical role, and here at Cuyahoga County, we're committed to fill that role and to innovate ourselves in beginning to ramp up and provide the necessary public health workforce to protect Ohioans now and into the future in the coming 1 to 2 years in responding to COVID-19. So those are my comments, and I'm happy to hand things over to Dr. Gullett.
Good morning. It's wonderful to see all of our media partners this morning. I sure am going to miss you all when this is all said and done, but I won't miss this. But I will miss seeing you all regularly. So thank you for all that you do to continue to update our community on the most important information about the COVID response. So this morning, in addition to thanking you, which I think is important every single time we're up here because this is a real sacrifice on your parts for being here, I'd also like to thank a few other folks today who remain critical but behind the scenes. And those are all of the people who keep our electronics and our communications going, particularly here at the Board of Health. We've all become incredibly reliant on our cell phones and our computers and remote conferencing technology, far more than I think any of us would ever wanted to become dependent upon. We're experimenting with backgrounds on Zoom and other conferencing devices, and when they don't work, we go, what do we do? We've been using conference calling a lot, and we had an episode yesterday where our conferencing system went down for a short period of time, and we had a conference call with a partner, and we were all sort of paralyzed for the moment. So we realized how dependent we've become. So I want to thank all of those people who work really hard behind the scenes, very dedicated public servants, to make sure we have all that we need to continue this response. Remote work will continue to be a way of life for many of us going forward, and for how long is unclear. It depends on how our community response continues to unfold and how adherent we all are to the continued guidance from our state officials, Governor and Dr. Acton, around social distancing, et cetera. But we know working remotely will continue to be important. So I thank all of you who continue to make working remotely and talking to people through remote distancing options available. Your technical expertise is appreciated daily, yet I have not called out enough thank you and gratitude. For us here at the Board of Health, I specifically want to thank Ken Ulick, Samantha Smith, and Dominica McClintock, who have been remarkable in keeping us moving. I also want to thank the colleagues we have at the Center for Health Affairs. I have mentioned them before, but I want to again mention them again today because they have been tireless before this in emergency preparedness planning, but also all the way through this response and now in the recent weeks figuring out zone collaboration. You've heard a lot at the state level about zone, but there's a team behind the scenes trying to figure out exactly what that looks like, as well as ensuring continued collaboration across hospitals and public health. And that is no small feat in a complicated county like ours, where there are so many organizations to coordinate. So I specifically would love to thank Beth Gatlin, Andrea Bishop, Tracy Pate, and Lisa Anderson for this, from the Center for Health Affairs, for your continued partnership. Seems like 24/7, and for always taking our calls and never forgetting about us over here in public health. We really appreciate you. So as I move on to the numbers, again, I want to remind you that these numbers, as they continue to climb, are easy to look at as just numbers. But please remember that these are all families, and these are all people in our community who deserve privacy, but also our respect and support as much as we can give them. The number of lab-confirmed cases to date in our jurisdiction, meaning the Cuyahoga County Board of Health, which excludes the city of Cleveland, our partners over there are reporting their own numbers as they have been throughout this whole pandemic response. Our cases are 1,150 for lab confirmed. Our probable cases are 413. And again, those are individuals who have a link, an exposure that we have confirmed to a lab confirmed case, but those individuals have not yet been able to access testing, but themselves have symptoms consistent with COVID infection. And that brings our total cases this morning to 1,563. The age remains unchanged for the range of 1 week of age to 101 years of age. And that age is the age at the time infection was diagnosed. And the date of illness onset ranges from February 20th to April 26th. So you can see we continue to have people symptomatic even over the past week, meaning that their exposure happened anywhere from 2 to 14 days before that, which is really important if we think about as we open up, critically important to monitor what happens over the next few weeks and make sure that people are adhering to the guidance that you heard our governor, Dr. Acton, and Terry Allen talk to you about. Our lab confirmed deaths this morning are at 75, and we continue to have one probable death. The age of the people who have died in our community is 53 to 97 years of age, and the date of deaths ranges from March 20th to April 27th. For comparison, this past flu season, we lost 36 members of our community due to influenza-related illness. So you can kind of get a sense for how that compares with the current pandemic that we're dealing with COVID-19. I'm very pleased to report, as of last night when we left, we had cleared 420 people from COVID-19 infection. That is cause to celebrate. And our team this weekend had a really wonderful conversation with someone who had been cleared of infection, who was home, and who had had the most invasive or the most complicated interventions you could possibly think of to keep her alive. And she is alive and home with her family, and that is something we celebrate. So we thank all of our ICU partners, the nurses, the technicians, the doctors in our intensive care units for helping our community members who are the sickest get through this infection. And then we get to celebrate with them on the phone when we call and ask how they're doing, and they tell us about their course of illness, and we realize how amazing their recovery really is. So we celebrate with each of you. I want to also just highlight for a moment that as we begin to reopen, we continue to have some groups of our population which are most vulnerable to this. We are all at risk for getting this infection, but we know that some people are more at risk for complications from the infection. So it's really important that we think about how we, as individuals, can protect other people from getting the infection from us. I would love for everyone to think, I'm the one who's infected. What can I do to prevent infection giving it to anybody else? Because you could be that person who's vulnerable, but so could the people that you encounter at the store or at work as people start returning to work. So please think about what you can do to prevent yourself from giving this infection to others, even if you don't think you have it. We know people in the community do have it without realizing it. The virus is still present, and it's still dangerous for many people, and it will be here for some time. We do preparedness planning in public health. That's one of the big functions we have. Behind us on this 100 years of public health, we have a lot of preparedness here, and that's because that's what we do. So we aren't just responding in the moment right now, but we're thinking about what we can do to prevent and prepare for what comes next as influenza begins to circulate again and coronavirus will continue to be in our community. So please continue hand washing. You too can be the hand washing champion wherever you are. Do it. I'm good with you washing your hands until they crack. That means that you actually are washing your hands all the time. Keep washing your hands. Keep cleaning commonly touched surfaces. We've said this many times today, many times before. We'll continue to say it. It works. It is a form of prevention. Please continue social distancing of 6 feet or more. We have a reminder here every morning for our entire on-site staff about social distancing. It's actually part of our standing agenda every morning when we meet, socially distanced. So we say, please do this all day long, the entire time you're here. We really mean that for everybody else as well. And please continue wearing masks. This is critical. It's gonna be part of our new normal for a long time. And again, this isn't just about protecting yourself from getting an infection. This is about protecting other people from you. And we want you to remember that. Please wear your mask. Please wear your facial covering. So, I want to also remember that this is a time of spring. This is very stressful for all of us. But I have been reminded over the last few weeks between the episodes of snowfall that spring is really here. And so in closing today, I would love to just ask everybody to find one moment, one piece of spring that you can hold on to today that gives you hope. Because we are finding hope in this difficult situation. And spring is here. It's a time of rebirth. We hope there's no more snowfall, but as we know, probably we can't say that until June, maybe here in Ohio. But look at the great flowers that are out. Look at the blossoms. I think seeing the green popping out is a chance for all of us to think we are getting through this together. And I'm really excited to celebrate when we are all safely through, but we can't let our guard down yet. So take a moment to relish spring, but also to think about what you can do to continue to protect everyone in our community so that we can all continue to enjoy many more seasons free of infection. So I think with that, we'll go ahead and take some questions.
You guys talk a little bit about how these new regulations with things reopening will be enforced and what people who have complaints in the workplace, customers and so forth can do.
I would love Terry to take that question.
Heather can answer. So Scott's question was, how will the new regulations be enforced and how will they be addressed? So that's where local health departments have been. That's been the space we've occupied for months. We've had a call center in place, which is still operating and operates every day. It's clear that public health has been charged by Governor DeWine to continue to work in that space to help businesses problem solve, to address complaints that may emerge, to address questions about which businesses can operate, how they should operate. And we're going to continue to do that. We understand that as a critical role in the community. I think our staff, environmental public health staff that have been very active throughout the response, have developed some strong relationships with business throughout in understanding how to best implement the rules to address concerns from residents that may emerge, from employees that may emerge, from patrons that may emerge. And so we have had that line in place. It's normal business hours, considering the nature of these, is 216-201-2000. You can be forwarded then on by our receptionists into the call center. So that will remain in place. I wanted to say something about masks. So, you know, these can be uncomfortable. They can sometimes, they sometimes feel restrictive. I get that. I feel the same way about a mask. But what I want people to understand is that when I put this on, if I have to drop something off at my mother's house, I'm protecting my mom because I'm wearing this. You're protecting your grandmother or your neighbor. So we want you to get used to this new normal, and it may feel awkward, it may feel strange, but it's bigger than you. It's about protecting people that are important to you and people that you don't even know. So if we're all doing it, it becomes a way to help to prevent spread of illness. It's like a flu vaccination. If enough of us get vaccinated against the flu, it can help to prevent spread significantly in the community. So that's what public health's about. Not us as individuals, but us as a community, as a greater Cleveland community. And so for me, that's what masks are about. Think about that when you put it on and it feels awkward, that you're serving a greater purpose than yourself.
Do you believe you guys have the manpower to keep up with complaints that may come in?
We believe that we have the ability to retask people to address the level of surge that's necessary. We know that on the contact tracing side that the governor has a plan to help local health departments increase capacity, and we welcome that plan going forward. If we need additional capacity for surge, we'll seek it out. We've been innovative throughout, and I'm confident that we'll continue to be as necessary. We've taken 6,000 calls to date back there, and we expect that to continue, and I'm proud of the folks that have been taking calls. Some people are upset about the way, how the rules may affect them, or concerned about risk for exposures, and they've been incredibly professional in addressing those concerns. So the question around whether we have the manpower, we believe that we have the ability to ramp up, if necessary, to retask temporarily based on surge, and if we need additional staff, there are plans, as the governor detailed, to try to help us build our capacity in the health department. So we're prepared to continue to respond. This is our time to be here for our community, and we're committed to that.
What sorts of sanctions, enforcement mechanisms do you guys have to enforce these rules and make sure both customers and businesses are doing what they're supposed to be doing?
Right, so Scott's question is about enforcement of the rules for customers, businesses, et cetera. So throughout this response, we've been working around the essential service designations and orders from the governor and from the director on response. Most cases, I would say the vast majority of cases, folks want to comply. There may be concerns about the rules and how it affects their business. This has been incredibly disruptive. Closures of schools has been disruptive. Closures of businesses temporarily has been disruptive for people, and we recognize that. And so there's been a lot of stress in the community in that response, and families. And so we recognize that when the calls come in. But I would say the vast majority were able in discussions to try and make sure that we come to a common understanding. There are mechanisms where we have to increase enforcement, and we will use those mechanisms as necessary, but it is not the first tool in our box. Education is the first tool in our box. We can work with our local communities and get support from our local communities to address businesses that may be having difficulty complying or where there may be challenges. And we do that normally in our work, and we do environmental health work around complaints and addressing environmental concerns. So for us, this is the way you do business. It's an expanded role for us in terms of what we're focusing on to respond to COVID-19, but it is not unfamiliar to us.
What are some of those expanded enforcement measures, I guess.
So an expanded enforcement measure might be that we have a discussion, whether it's in person or remotely with the business, perhaps other members from the community that are in a service or support role, to talk it through with them, to understand what the challenges are. Those are usually informal discussions. We can then increase that to have something more formal in terms of hearings. In some cases, as you've seen relative to the essential service designation, there have been some court-related proceedings, but those are very rare. We haven't needed to take that route. And I think because people understand, and certainly the surveys have shown that the vast majority of Americans support these public health protective measures to try and reduce the risk of exposure. So we're confident that that will continue, and we would say that those stepped-up enforcement that may require hearings or seeking court action will be few and far between, because people have been so considerate of the bigger picture and really trying to help their community. So,
Is there a plan to ensure safety of the county right now?
so beginning, going back now, I've got to believe, probably 5-6 weeks, maybe more. We've been working very closely with the county administration and Metro Health, who, as you know, provides the medical support for the inmates at the County Corrections Center. And so you may recall that when they had their first cases some weeks ago, we actually were here with them. Julia was here, Dr. Julia Bruner was here with us, along with Executive Armin Budish, reporting that out. As soon as it was known, they were here on the spot that morning. And since that time, it's important to note that they've been working through cases where cases have emerged to respond. They've been instituting preventive measures. They had been tabletop, basically practicing response well before that in February. They were preparing for cases, looking at national guidelines, looking at CDC guidelines, and their experience through all of this, because it's important to know that in these congregating group settings, that cases were inevitable and will be inevitable in these group settings. So it's more about what you do when cases emerge and how you handle them. And their experience has been incredibly instructive in these past few weeks, to where I believe that Metro Health and Dr. Bruner are an incredible asset to our community in helping to advise other congregate and correctional institutions on how to handle these circumstances. If we think about state correctional facilities, which there are some here and certainly all around the state, they have an incredible set of guidelines that they had built in advance. So preparation is critical. I've responded and been involved since post 9/11 to anthrax and smallpox and H1N1 in 2009, Ebola in 2014. I've talked about that a number of times. And what happens in between those events is lots of practice, planning, drilling, in order to assure that we're not showing up when an event occurs and passing out business cards. We already know the players, we know the plan. When we practice, we find out what doesn't appear to be working, and we look to improve. And so that is our continuous improvement model that has been tried and true for public health, and we're going to continue to follow that.
And is testing capabilities still available the way they are at Marion and Colette?
Yeah, so testing you're talking about specifically, the question is about testing capacity at the county correctional facility. Yes, Metro Health has provided support for testing capacity at that facility since the beginning, and continue to provide that support. We feel that that's been a great partnership, and the key is in the response, knowing that the inevitability of cases, it's a matter of how to contain it. And I think that there's a lot of, the community said had a lot of practice with that, and certainly at the correctional facility, we believe they've taken every measure to prevent cases and prevent spread.
PPE as well?
Yes, PPE, we've been very fortunate here in that we haven't seen the surge because the curve has been flattened. So the question is personal protective equipment continue to be available at the correctional facility? Across our community, even more generally, we've been very judicious about use of personal protective equipment. We've received successive shipments from the Strategic National Stockpile here. We've had donations from very generous people in our community for personal protective equipment. We continue to receive those. And so we believe that in the near term, we're asking people about their PPE needs over the next week to try to make sure that we are carefully dispensing PPE. So with that, we have one more question.
Have you guys received any sort of indication how many additional staff you guys could get as far as contact tracers?
So the question is, has the Cuyahoga County Board of Health received information about how many additional staff we could get to do contact tracing? So this announcement on numbers was made yesterday. So we're in the process of working with our local and state health department colleagues, as we have from the beginning, to make a determination on what those staffing levels should look like for us going forward. That means that we've got to be thinking about volunteers. And Dr. Gullett has helped us to marshal, an army of medical students from the Case Medical School who have been fantastic as our volunteers from the beginning, in addition to some public health physicians that we've worked with. And so that's the first piece, is intermittent volunteers. The second is that we have staff on site that have been detailed because of their programs being put on hold. And so those staff have been detailed in to assist with contact tracing. The last piece is now working to figure out what additional staff we need to bring on, the number, and we don't have that yet, but to figure out what that number is. And we're glad that the governor is committed to help the public health workforce, the local public health workforce in Ohio, to do the job that he needs us to do. And so we're committed to understand that better in the coming weeks and to begin to build up here as we move into the summer to plan for a potential surge in the fall as we turn toward flu season. So we've got some planning to do, and we've got to get busy. We can stop and rest for a moment, but we've got to get back to work. So with that, we're going to end today, and encourage your neighbor to wear the mask, and encourage folks not to be complacent here as we go forward, and recognize that we are in this for the long haul, and we're in it together. Thank you.